Good afternoon. Fixed prosthodontics and FPD designs and implant configurations. So what do we understand by this? We want to we want to see in which situation what kind of fixed prosthesis design has to be given for the patient. So the replacement of missing teeth has been considerably changing in the last few years. So what has been happening is uh, in the last many years the mode of treatment is being changed. So conventional fixed prosthesis has been slowly and gradually replaced by implant prosthesis. But in all situations, we should know what is the correct prosthetic design which is suitable for that patient. So it is not just a simple choice between fixed prosthesis and removable prosthesis. Now the implant has been uh, widely accepted as a feasible prosthetic option for the patient with missing teeth. So, and also you should know that though it is a widely accepted treatment option, some patients may not be suitable for having implants and they will still need conventional fixed prosthesis. So we should know proper treatment planning to get uh, ideal prosthetic situation for that patient. So let's look at that. So implant is generally suited for replacement of missing teeth, a single tooth. Like in this situation, if you look at this case, you want to here you want to go with the implant as a missing option for replacement of a single missing tooth. But on the other hand, when you have a patient with multiple destructed teeth, you want to go with a conventional fixed prosthesis. Maybe try to save whatever you can, like post and core, endodontics, post and core, and then so you can never tell that all the patients will need implants. So many situations you will need to go for a conventional fixed prosthesis. For example, if your abutment teeth are grossly decayed and they need single crowns, you can as well give a 3-unit fixed prosthesis instead of a single implant for this situation. So what are the clinical applications? Let's see where we should give fixed, where we should give implant, and where we should give removable prosthesis. So you should always avoid long span prosthesis. So they should be always supported by implants. So any situation where there are more than 3 teeth missing cannot be ideally replaced with a proper fixed prosthesis. And in this situation, you have to go for an implant. So they say that ideal or a maximum number of teeth which can be posterior teeth which can be replaced by fixed prosthesis is usually 2. More than that, it should go for a implant prosthesis and it should not be replaced by conventional fixed prosthesis. But in some rare situations, you can attempt when there are 3 missing teeth. So we'll look at all these situations. So in this slide, we can see here upper posterior area with all the molars missing. So in this situation, fixed prosthesis is not feasible. You can offer either implant or a removable prosthesis for this patient. Similarly, in the maxilla here, canine to canine, 6 anterior teeth are missing. So this should be ideally replaced with an implant prosthesis. The patient cannot afford or any other reason which is contraindicating the implant, you can go for a removable prosthesis instead of a fixed prosthesis. So an edentulous space which is created by loss of 4 adjacent teeth other than 4 incisors is best restored by implant or a removable prosthesis. What does it mean here? So if you have a patient with missing centrals and laterals, you can give a fixed prosthesis, but anything more than that, when the canines are also missing, you should go consider removable or an implant prosthesis. If more than 1 inch space exists in the arch, so it is better to go for FPD and or implants and only when because of very poor finances, that is the only criteria where you should go for a removable portion denture. And it is also true when the spaces are bilateral involved 2 or more teeth. So you want to reduce the number of edentulous spaces by replacing them with fixed prosthesis and not to complicate the removal design by having multiple missing areas. So implant will be taught to you in detail, but for now, what you should understand is what is an implant. An implant is a titanium alloy or a pure titanium fixture or a device inserted into the bone. On this, once it is inserted into the bone, it will undergo what is called as osseointegration. Means it will integrate with the bone, and after an initial healing period, you can create the prosthesis. So there is an implant, there is an abutment. Abutment is a tooth or a portion of a tooth which supports a fixed prosthesis. There is an implant abutment, and then there is a crown. Now this crown can be held by cement or it can be held by screw type. So you have either cement type or a screw type. This is a screw type. So there is an access opening for where the screw can be tightened. So this crown can be cement type or screw type. This is what we mean by we want to replace. So here it can be cement type or a screw type prosthesis. So we need to understand few concepts here. So how to determine the abutments? You want to know the Antis law. What does Antis law? The combined root surface area of the abutment teeth to be replaced should be abutment teeth should be less than by the abutment teeth. So what do we mean by this? The root surface area of the abutment teeth has to be equal or greater than the teeth being replaced. That is the pontic area. So if the patient has one or two teeth missing, the abutment teeth should have greater root surface area than that of the. So that means that only when one missing tooth is there, it can be easily be replaced by a fixed prosthesis. But if two teeth are missing, a fixed prosthesis has reached its limit, and more than two teeth, the root surface area may not be sufficient for the abutment teeth. So that's what Antis law means. So they have done studies and they have found out that the root surface area of the teeth is generally in this measure. So the maximum root surface area in maxilla is for the first molar, then for the second molar, and then canine, followed by premolar, first premolar, central incisor, second premolar, and the least is there for the upper lateral incisor. This is a broad measurement, it can vary, but generally you should know that the root surface area of the maxillary first molar is maximum. Similarly for the mandible, slight modification is there. So here the central incisors are weak. So the central incisor is the weakest tooth compared to the upper arch where the lateral incisor is weakest. Similar remaining teeth are same. So the maximum is for the first molar, the second molar, canine, followed by second premolar, which is greater than the first premolar, and then lateral incisor, the least is the lower central incisor. So you should broadly remember, you don't need to remember the values, but you need to know which tooth has greater root surface area. So keeping these things in mind, so you should plan for the abutment teeth. You have the rough idea about the root surface area of the available teeth, and you should know the root surface area of the missing teeth, and roughly you can calculate which is the abutment teeth which are required for the situation. So what are the ideal abutment requirements? You should know that ideal abutment should have no drifting. That means there should not be much of angulation changes. You can use additional abutment if there is some drifting or bone loss. So the ratio of the root surface area are intended as a general guideline. So the root surface areas available is a general guideline based on average tooth dimensions. So it can change from patient to patient. So what do we need to remember? The abutment pontic root ratio should be 1 or greater. That means the available root surface area from the abutment should be equal to or greater than those of the missing teeth. And conventional partial coverage restoration should be used for many prosthetic situations, but you should know the limitations of partial coverage restoration. And also keep in mind and keep it as a rule throughout your career, third molar should not be considered as an abutment. So if the patient has missing second molar, it should be replaced by an implant or by removable prosthesis, and fixed prosthesis is not possible because third molar, even if it is present, is not a suitable abutment. Why is it? Because it has, generally it is not fully erupted, and then there is always some inclination, and generally the roots are thin and narrow and fused. And also the attached gingiva is very minimal around the third molar. For all these reasons, third molar should not be considered as an abutment unless until it has migrated to the position of the second molar for whatever reason. The roots are nicely well formed and widely spaced, and the crown is sufficiently long enough. In that situation, maybe you can use it, but in situations, third molar is not a suitable abutment. Now we need to know the classification. If you want to understand the designs, you need to understand a simple classification here. A prosthesis can be classified as a simple or a complex prosthesis, depending on the number of teeth to be replaced and the position of the denture space in the arch. So a simple fixed prosthesis is one that replaces a single tooth. So a simple prosthesis is nothing but a prosthesis which replaces a single tooth. So in our curriculum, you are supposed to do only a simple fixed prosthesis. Any prosthesis which replaces more than one tooth is not a simple prosthesis. It is considered as a complex prosthesis, like there. So we have this classification for this understanding. Simple fixed prosthesis, one tooth missing. Complex fixed prosthesis, one tooth missing. So we will know which situation. Even a single missing tooth is complex. Simple fixed prosthesis, two teeth missing. Complex fixed prosthesis, two teeth missing. Complex prosthesis, more than two teeth. Any patient with more than two teeth missing is a complex fixed prosthesis. Complex fixed prosthesis where there is a pire abutment situation. Depending on the support of the FPD, that was depending the earlier classification, depending on the number of missing teeth. Support for the fixed prosthesis, you can have a conventional tooth supported FPD, what we do in our clinics. Resin bonded fixed prosthesis, which is a separate lecture, maybe in the second or third semester. Hybrid bridges, which is nothing but fixed and removable bridges, and then implant supported FPD, which is additional. You have a course in the 6th year, but you will not be practicing implants in the at the undergraduate level. Now, for your understanding, this is what a resin bonded FPD will look like. So only partial preparation of the tooth is carried out, and the missing tooth, that is a pontic, will be stuck with the adhesive cement to the lingual surfaces of the abutment teeth. So it is partially covered and it is held with the help of resin. Now, depending on the type of connector, we can further classify the fixed prosthesis into fixed prosthesis. What is a fixed partial denture? A partial denture in which the fixed prosthesis is totally fixed and attached to the mouth. You have a fixed movable partial denture where a portion of the prosthesis is fixed in the mouth and the portion there is a movable joint. So this movable joint is nothing but a precision attachment. It is used in some situations. When we look into the further part of the lecture, you will understand what is a fixed movable partial denture. Then there is a fixed removable partial denture. Where is it used? When there is some attachment retained partial denture, you have some fixed element and you have a removable element. So it's a fixed removable partial denture. And then there is a modified fixed removable where there is a removable segment and there is a fixed sub segment with the help of a bar. So why do we use a modified fixed removable partial denture? Some patients will have surgical or traumatic injuries where there is a lot of bone loss and soft tissue loss which cannot be covered with a fixed prosthesis. You have to need acrylic flange, so removable prosthesis will be indicated. In such situations, you will make a bar supported fixed prosthesis and then a removable segment which can be removed by the patient is made over that. So it is a modified fixed removable partial denture. It was given by Andrews, so it is called as Andrews bridge. Now, depending on the length of the denture span, you have short span FPD and long span FPD. So these are all the terminologies which you come across, but in this lecture we'll be covering based on whether it is simple or complex. So we'll follow that classification, but all these are relevant terminologies which we will come across. Also, depending on the material of choice what we can have all ceramic. Also, depending on the material of choice what we can have all ceramic, all metal, metal ceramic and acrylic. Acrylic is only used as a provisional fixed process. So let's look at the first criteria. Simple fixed prosthesis, one tooth missing. So here in this example here is upper central incisor. What are the abutments? Abutments will be central and lateral, and then if you have an implant configuration, it will be a single implant. So an implant configuration, you will have a single implant. For a fixed prosthesis, you will have two abutments. So right now you should understand what are the types of pontics which you have to give. So broadly only two pontics will be clinically applicable. You have a modified ridge lap and you'll have a sanitary pontic. So which are the situations where you'll give a modified ridge lap? Modified ridge lap pontic is given in maxillary anterior, maxillary posterior and mandibular anterior. So this three areas you will give modified ridge lap. And then mandibular posterior, you can go for two types of pontic. Either you can go for a conical, or you can go for a sanitary, or you can also give a modified ridge lap. So all the variations will be only for the mandibular posteriors. In addition to this, you have another pontic called as an ovate pontic, which is given in freshly extracted sockets to make it look like a root emerging from the tooth is emerging from the socket. So these are the pontics which you need to remember. All the other pontics have limitations. So when someone asks what is the pontic design, you should be able to tell depending on this criteria. So for a simple fixed partial denture in the upper anterior, you have a 3-unit fixed prosthesis when a central is missing. Then maxillary lateral incisor also a simple case. The abutments will be canine and central incisor. There will be a single implant for replacing this as an alternative. Then another simple prosthesis when lower central is missing. So the abutments are adjacent central and the lateral incisor. Mandibular lateral incisor missing, also a simple case. The abutments will be central and canine. Maxillary first premolar missing, it is also a simple case. So simple fixed prosthesis abutment will generally be a canine and a second premolar. But in rare situations, when the canine is totally well formed and intact, and for some reason the molar needs endodontic treatment and a crown, you can give a cantilever from molar, first molar, second premolar, and the pontic will be cantilever from the two. So this is also a treatment option available. This is only for maxillary first premolar. You can give a cantilever if the molar for some reason needs some endodontic treatment. Then mandibular first premolar, the abutments will be canine and second premolar. So what is a cantilever fixed partial denture? Cantilever fixed partial denture is nothing but a partial denture which has abutment only on one side. So there are no two abutments on two sides, the abutment is only on one side. So there is limitations because it will have a lever action, it will exert excessive forces on the abutment. So it is generally not indicated unless until you are specifically following some criteria, like if the opposing prosthesis is a complete denture or a partial denture, when the occlusal forces are minimal, you will give a cantilever partial denture. Also, when the clinical situation, the occlusion is very mild, maybe there is an open bite, when there are forces are minimal, in such situation you can plan for a cantilever fixed partial denture. So where is it given? Generally for replacement of a maxillary lateral incisor or a maxillary first premolar. What criteria you should keep in mind? There should be no occlusal contact on the pontic, and generally the pontic size is smaller compared to the original missing teeth. So clinically these are the situations which you can see. This is a conventional fixed prosthesis. This is a cantilever only supporting from the canine. So given generally for upper lateral only in very minimal situations where the bite or the occlusion is not too strong. Also given for a mandibular or a maxillary first premolar if the molar requires a crown for some reason. So there will be two abutments, molar and first molar and the second premolar, and the first premolar will be a cantilever. Also can be given in situations where opposing complete denture, there is a pontic, first molar is missing. So it can be minimally placed. You don't place a very large posterior cantilever. You can give a premolar shaped cantilever fixed prosthesis for missing first molar, provided the upper occlusion is a partial denture or a complete denture. Then further simple fixed prosthesis. What is this? Mandibular or maxillary second premolar missing. The abutments will be first premolar and first molar. Similarly for mandible, first premolar and first molar will be abutment for mandibular second premolar missing. Maxillary first molar missing. This is also a simple fixed prosthesis. The abutments will be second premolar and second molar. Similarly for mandible, second premolar and second molar will be the abutment for a missing mandibular first molar. Maxillary second molar, as I said, the only option available is a single implant or a removable prosthesis. You do not give a conventional fixed prosthesis. Same for mandibular second molar. If it is missing, the only treatment option should be a single implant. Now, let's see complex fixed partial denture when one tooth is missing. So what is a complex fixed partial denture when one tooth is missing? Example is maxillary canine missing. When the maxillary canine is missing, the lateral incisor is a weak abutment. It is not sufficient to support the prosthesis. So you will have to take support from the central. So it will be a 4-unit fixed prosthesis, which makes it a complex fixed partial denture, even though only one tooth is missing. The ideal treatment will be go for a single implant for missing maxillary canine. Missing mandibular canine, also the same problem. You will have to take two anterior abutments and also first premolar. So it prosthesis. The ideal replacement will be one single implant for the missing canine. Simple fixed prosthesis when two teeth are missing. So it is still simple even though two teeth are missing. Example is lateral and central are missing. So the central and canine are sufficient for supporting the two teeth missing. Implants will need two single implants. Mandibular central incisors missing. In this situation, the abutments will be only lateral incisors. The reason are the root surface area of lateral incisor is sufficient to replace two lower central incisors missing. Simple fixed prosthesis when two posterior teeth are missing, two maxillary premolars missing. So this is also a simple fixed prosthesis. The abutments will be canine and first molar. If you go for implants, you will place two implants for the same. Mandibular first and second premolar are also simple fixed prosthesis. Abutments will be similar, canine and first molar. Maxillary second premolar and first molar missing. It is also a simple prosthesis provided the root surface area is good. The abutments will be first premolar and second molar, provided the roots are well formed. If not, you will have to take support from the canine and it is no longer a simple fixed prosthesis. Mandibular second premolar and molar missing is not very easy because the first premolar for mandible is generally not root is not generally too long. So you will better to take canine as support and it is a complex fixed prosthesis when you involve the canine. two posterior teeth missing, that is 2 molars, you cannot replace by fixed prosthesis. It has to be a removal or a implant supported prosthesis. Same for mandible. Complex fixed partial denture when 2 teeth are missing. So what are the situations? When canine and any other tooth in the anteriors are missing, like here, lateral and canine is missing, one central and lateral is missing. Sorry, one central and lateral is missing. The central incisor on the other side is not sufficient to support. So you take 3 abutments. So lateral, central, and canine. So it will be a 5-unit prosthesis. As we read, any situation where the span is more than 4 teeth, it will be a complex partial denture. So it is a 2 teeth missing complex partial denture. Similarly, 2 maxillary central incisors missing. When 2 maxillary central incisors are missing, the lateral incisors are generally weaker. They are not sufficient to support 2 central incisors, so you take support of canine. So there will be 4 abutments for 2 missing teeth. So this will be a complex 2 teeth missing situation. Also, when canine and lateral incisor are missing, generally this tooth situation you should not give fixed prosthesis. You should go for an implant prosthesis. The reason is there will be 2 posterior abutment and 2 anterior abutments, so it is a very long span prosthesis, and aesthetically it will not be easy to match the situation. So better to go for 2 implants for canine and lateral incisor. Mandibular, lateral, and canine missing. Here also it is complex. You will have to take support from 2 anteriors and 1 premolar. So it will be a 5-unit prosthesis. Maxillary, canine, and first premolar missing. Also a very complex prosthesis. You will need 2 posterior abutment and 2 anterior abutments. So it will be a 6-unit prosthesis, long span, and better to give a implant prosthesis. This is a difficult prosthesis. You should not attempt such cases. Mandibular, canine, and first premolar missing. Here also 5-unit prosthesis. Better to replace by 2 single implants. Complex fixed partial denture, more than 2 teeth missing. So as we said, any situation where there is more than 2 teeth missing is a complex fixed prosthesis. Just for example, 2 centrals and lateral missing, it will be canine to canine prosthesis. It will be a complex fixed partial denture. So you can place 2 implants and make a 3-unit FPD or 3 single implants. So you may ask, why should we know about implants even though we are not doing implants? You should know the number of implants involved because you have to counsel the patient. When the patient comes to you, you should be in a position to tell, see, for your situation, you will need 1 implant, you will need 2 implants or a fixed prosthesis. So you should know the number of implants. You may not know everything about implants, but at least you should know the number involved, or if the patient has 1 tooth missing, how many implants. If the patient has 3 teeth missing, how many implants he will need. So for this, you should know. Just let's look at a complex case when 4 upper anteriors are missing. You can give canine to canine FPD, but generally canines may not be sufficient, so you'll have to involve the first premolar also. So it will be an 8-unit prosthesis, which is a very long span. Ideally, you can place 2 implants on the lateral incisor and make a 4-unit fixed prosthesis. When 4 anteriors are missing for mandible, canines are sufficient to support. It will be a 6-unit lower anterior prosthesis. You can also place 2 implants in the lateral incisors and make 4-unit fixed prosthesis. As I said in the first slide, any situation where 3 posterior teeth are missing is a complex prosthesis. Canine and second situation where 3 posterior teeth are missing is a complex prosthesis. Canine and second molar can sometimes be used to make a FPD when premolar and first molar are missing. When the support is very good for the canine and also for the second molar, you can give a fixed prosthesis, but it is depends only if the opposing occlusion is a removable denture. If the opposing occlusion is completely dentate patient, you should avoid such a prosthesis and go for implant supported fixed prosthesis. For mandible, you can never give canine to second molar. The reason is mandibular prosthesis will be arch shaped or curved like this. So when there is a natural curvature in the occlusion, the amount of occlusal forces falling will be excessive and it will cause too much forces to fall on the canine and the second molar. So better avoid remove fixed prosthesis when three posterior teeth are missing in mandible and always go for implant or a removable prosthesis. Now we'll learn about pyre abutment. What is a pyre abutment? Pyre abutment is nothing but an abutment with edentulous space both mesial and distal to it. So in this situation, there is one missing tooth on the front of the abutment and one on the posterior side. So what happens when you have a pyre abutment situation? Just look at the clinical photo. So when you have a pyre abutment situation, the abutment is generally in the middle. There is missing tooth on both sides. So what happens is the forces falling on the abutment will be excessive. So to prevent the excessive forces, you have to use what is called as a stress breaker. So what is a stress breaker? It is nothing but a precision attachment. So the prosthesis is made in two sections with precision attachment on the distal side of the pyre abutment, and the prosthesis is cemented in two positions. Like the anterior segment is cemented and the posterior segment is cemented into the oral cavity. So when you do this, this will permit some movement of this abutment posteriorly and prevent excessive forces from falling onto the abutment. So where is the precision attachment? Precision attachment is on the distal surface of the pyre abutment. The slot is on the distal surface and the key is on the mesial of the pontic. So this you should remember. In the lecture, I have put some clinical scenarios where pyre abutment can be used. You don't need to know in detail at this stage, but you should know how a pyre abutment looks like, what is the purpose of a pyre abutment, how to design a semi-precision attachment. So this is about the lecture. So the lecture may look long, but it is, you have to remember what are the abutments which are suitable. What is the pontic you should know. As I told you, only two applicable pontic designs are there. And in what situation, what kind of abutment is given. And if required, the number of implants which you should give. The size of the implant and all this is not relevant at your stage. So when you are in later years, maybe sixth year or in internship or when you're doing a postgrad, you should know the size of the implant also which is given. But in the textbook, everything is there. The size of the implant also is noted down. So in the slides, you may see the size of the implant depicted, but at your stage, you don't need to remember the size of the implant. You just need to know, is it a single implant or two implants which are required? And you should know the classification, which is simple fixed prosthesis and complex fixed prosthesis. In simple, you have one tooth missing and two teeth missing. In complex, you have one tooth, two teeth, and three teeth missing. That's what you should know. So these are all the slides which are showing pyre abutment situations. So this is about the lecture. So if you need further understanding, you can contact me in the revision lecture option. We can retake the lecture.